Welcome to our Facebook Live. Our update every day, Monday through Friday, 5 p.m. Y'all know this one. This is Andre Day, Rise Up. Y'all know this. I rise like the day, I rise up, I rise unafraid, I rise up, and I do it 1,000 times again, and I rise up. This is I like the waves, I rise up, in spite of the 8 times again, and I rise up. And I rise up, and I do it 1,000 times again. The silence. Thank you for listening to our Facebook Live update. We have some special guests for you today. Just want to shout out a couple of people before we begin, as I usually do. Lisa Mitchell, how you doing? Darryl Lott, Eva Aquino, Tarek Holland. How you doing? Luis Ortiz, good to see you on here, man. Sarah LeBron, how are you? Nayana Turby, how you doing? Devon Sally, how are you? Maisha Williams, how's everybody doing? Glad to see y'all on our live. Appreciate you being here with us today. We're going to get started. We have a bunch of incredible guests with us today that are going to help us deliver the information to you this afternoon. We have Aisha Glover, who's the president and CEO of Newark Alliance, but she is also part in charge of our contact tracing program here in the city of Newark. Director Phil Scott, who is our director of Department of Engineering in the city, who's been heading up our data team as it relates to this COVID-19 stuff and all of the things that I report. He analyzes and gets that information to me so I can get it to you. I'm gonna have him talk a little bit today. And Dr. Joya Mukherjee, who is with Partners in Health, who is partnering with us around this contact tracing, and we are deeply, deeply indebted and happy that they're here with us to deal with this virus. And we're going to get at it, do what we can to make sure that it is no longer harming us here in the city of Newark, and we can protect our families. So we thank them for helping us get this done. I'm going to start by giving out the numbers that we have, like I usually do. In Newark, we have 6,529 positive cases. Yesterday, we had 6,462. That's an increase of 67. So it's a little bit more than it was yesterday in terms of the increase. Well, actually, it's twice as much as almost that we had yesterday, but the number is still low in comparison to what we've had in the previous weeks, and I'll let Phil talk about that a little bit. Director Scott, we have 527 deaths in the city. Yesterday, we had 520, so it's 7 additional deaths. 7 is a lot, but it's certainly lower than what we usually have. Essex County is 16,103 positive cases with 1,520 deaths. New Jersey has 142,798 positive cases with 9,956 deaths. Yesterday, I was able to get on a community call with some folks from the North Ward. It was a great call. I just want to shout those residents out from Forest Hill, Lower Broadway, and all of the folks that were on that call who had a first-time opportunity to look at the numbers in their area and were very concerned and are supportive of the city's efforts and work and trying to make sure we recover from this. So just the zip codes, 07102, we have 230 cases, 07103, 745, 07104, 1,288, 07105, 982, 07106, 672, 07107, 1,049, 07108, 546, 07112, 518, 07114, 262. So though you know your zip code, you know what the numbers look like in your neighborhood, in your area. Please take heed to those numbers and do what's necessary to protect yourself and your family. The deaths by those same zip codes are 07102-24, 07103-97, 07104, 110, 07105-36, 07106-64, 07107-64, 07108-61, 07112-47, and 07114-21 positive cases, deaths in that area in the city. So, and as the state opens up at a faster pace than we are in Newark, I'll give you those numbers so you can understand why we are not moving as fast as the state, that we have a different cohort here in the city, and our numbers are dramatically different than they are in Ocean County, than they are in Cape May County, and all of the southern parts of New Jersey, where the beaches are. So if you on Memorial Day feel like you want to get up and take your family to the beach, I just want you to be thoughtful and careful about those decisions, because you are coming back home to this area, and we definitely would not like you to come home with something you didn't leave with. It's important that you take these things into consideration as you maneuver around the state based on what the governor's orders are. And he has to be the governor, like I said, for the entire state of New Jersey. He has a difficult job. I'm not the governor of the state of New Jersey. By the grace of God, I have to worry about you guys here in the city of Newark. And so my determinations and everything that I make is based on what the data that I get here in the city of Newark. So let's just be mindful of that. We're going to be coming out with a few things next week to kind of tell us where we are and what we look like in terms of the summertime opening up and what that looks like for Newark residents. I know you're a little anxious. We've been in the house for 2 months, but look, it's been working. It's been a 2-month period that's been working. And we need to hold the line until we get a clear pathway forward, y'all. So in that note, I'm going to talk a little bit more later, but I want to give these folks an opportunity to give you some information here with us. I want to first introduce Aisha Glover, give her an opportunity to talk about what she's doing and how it's impacting the city.
Sure. Thank you, Mr. Mayor, and thanks for having me on. I'm happy to share a little bit about the contact tracing efforts that are underway. Obviously, been listening to you and the information that you've been sending out to the community to make sure that we're really clear on what the process is. I have been reading, and I'm fully aware of what other countries are doing, what that's looked like in South Korea, what it's looked like in India. But today, what we're hoping to do and what the mayor's been doing is wanting to make it clear on what that looks like for Newark, right? And so there's a lot of misinformation. There's some fear tactics. There are some things that are 100% valid, just around legitimate privacy concerns. But the methods that the city of Newark is currently using is really rooted in good old-fashioned phone calls. And so the effort that the mayor asked us to help stand up in partnership with the Department of Health is really rooted in how can we help to get in front of this as quickly as possible by alerting people that came in contact with someone who was who tested positive. Fortunately, we have a highly collaborative city. We've had institutional partners, we've had philanthropy, we've had folks that have historically partnered very well with us, whether it's Rutgers, whether it's the MCJ Amelia Foundation, and others that have said, how can we support and lend additional support and capacity to the city? So with that, we were able to identify and help bring on partners in health. So Joya is going to share a little bit more about what their role is. We've been able to partner with Rutgers School of Public Health, the Global Health Institute, with Rutgers Newark through their Lives in Translation program. So we're specifically working with folks that have capacity and expertise. We've tapped into underutilized city employees or city employees who, quite frankly, just want to volunteer on their downtime. We've tapped into Newark Public Schools, where the superintendent has stepped up and provided dozens, if not upwards of 100 of his own staff. So the necessity is the mother of invention, right? And so the fact that we were able to pull together such a great collaboration to help solve a problem and help address a need in the city of Newark in such a short period of time without resources, right? So we're all used to working without access to much resources. And so that's why we've been tapping into this kind of quote unquote volunteer cohort. But again, folks that have been fully vetted, that have gone through a pretty intensive training program that we relied on our educational institutional partners to help us develop. And of course, the expertise of Partners in Health. Using that as the platform, the module to roll out training to be integrated with the Department of Health. And most importantly, so that way folks can immediately and quickly get on the phone, contact people, and identify where there's additional support or resources needed, right? So this is not contact tracing for contact tracing's sake, right? It's not for data. This is not for a way for us to just try to learn what we don't know. What we're trying to do is make sure that we could be informative and that we can connect people to resources. Do you have the ability to self-isolate? Do you have the ability to self-isolate for 14 days? Do you live with other people that could potentially be affected? Are you exhibiting any symptoms? So we're looking at that in order to better connect people with those resources that are available in the city. So that integrated approach is critical. We're not using an app. We're not tracking you. Phones are not, there's not gonna be alerts that go off on your phone if you come in close proximity to somebody who's tested positive. In fact, we only get the information kind of scrubbed. We don't even know who the infected party is. We're getting, here's the list of the contacts. And for those of you that are old enough that remember when this was happening during the AIDS epidemic, the same concept there, wanting to make sure that you're informed that you had come in contact with somebody who was exposed. So that's kind of just the process in a nutshell. Mayor, you already know this, but I think you've done a phenomenal job, even if it's caused us many sleepless nights of trying to stand up a program in a ridiculously short period of time that's been unprecedented. Joya could talk a little bit about what they're doing statewide in Massachusetts. The state of New Jersey has just announced they're going to be rolling out an effort statewide. And quite frankly, they're looking to Newark for what we have already done around the curriculum development, around the technology platform. The state is going to be using the same platform. So all that integration and your leadership in just pushing us to get this done, I think allows us to be in the space right now that we're shooting for at least 100 calls a day and getting that information out to the residents that need it the most.
That's excellent, excellent, excellent. I want to move quickly on to Dr. Mukherjee, talk to us about Partners in Health. Thank you for being here with us again. So whatever it is that you want to share with us. You're on mute. You're on mute. You're muted, doctor.
Unmuting. Hey, so thank you so much, Aisha, for that excellent explanation of what contact tracing is. And I want to really thank the mayor for having us, inviting Partners in Health to work with you guys in Newark. We're really honored. I am a practitioner of what's called social medicine. And what's social medicine? That is the concept that medicine is not equal. And this pandemic, we know, is not going to have an equal impact on rich communities, on poor communities, on white people and Black people. This epidemic, like all epidemics, like most of health, will track along the fault lines of historic injustice, unfairness. And when we launched the contact tracing initiative in Massachusetts, the very first community that asked for our support, help, counsel was the city of Newark. And that is because of the great leadership of Mayor Baraka. That's because of the great work that Aisha is doing with the Newark Alliance, with all of the partners here, Rutgers, MCJ Amelia Foundation, and the City Department of Public Health. And so I really want to commend the mayor for this leadership, because public health and solving these difficult issues is about leadership. And to put the blame on others, to deflect, is not leadership. To take it on and say, this is where we are, and communicate it clearly, that's the whole ball game. And we can work with that, and we're just so delighted to help. And I want to say that Partners in Health is helping voluntarily. We want to help the city of Newark. We're not getting paid. There's nothing behind our engagement other than solidarity with the city of Newark, a city that's well led and a city that's been fighting for many years for equity. And you are leading your state, and we're just super proud. And super proud to be part of the reopening and recovery strike force that the mayor has set up, and really trying to figure out how Newark can beat this thing. So Partners in Health is a 35-year-old medical organization. We mostly work in Africa, Latin America, Haiti, where we stand in solidarity with governments, with public health departments, and with community members. And we've spent the last more than 3 decades working with people to solve these difficult health challenges. And in many countries we work, we see a lot of infectious diseases. We've worked on HIV, on tuberculosis, on Ebola, on SARS, on all of these epidemics. And what we know is that the way to stop it is contact tracing and linking people to resources. So, when we look at the death rate, and every day the city of New York was on TV for the work and the hospitals and all that, that's only about 20% of the epidemic. The other 80%, that bottom piece of the iceberg, that is people who are not very symptomatic, and they don't even know that they might be spreading this infection to their families. So right now we're doing social distancing around the country. Social distancing is not enough, and it's deeply unfair, because it's easier to social distance if you have a salary. It's easier to social distance if you have your own house. But it's harder to social distance when you have an hourly wage, when you drive a bus, when you don't have a good place to stay. And so the way to have equity in the response to COVID is to contact trace, which means you call someone and say, you were contact. And first of all, how are you? Right? Because if you're sick, you need care now, yesterday, right away. Second, okay, you're not so sick. These are the things you need to know to quarantine. You need to try to separate yourself out from people in your family. You need to have bleach to wipe down the surfaces. You need to not share meals. Can you do that? If you can't do that, then we need to connect you to the resources that will help you do that. Because the difference between social distancing and contact tracing is resources, right? It's really trying to target the people who are most at risk because they can't protect their families. So this is not about spying, or as Aisha said, about knowing for the sake of knowing. This is knowing for the sake of equity, knowing for the sake of social justice, and knowing for the sake of putting resources in the places that need it most to protect the most vulnerable people. And one of the reasons we were so excited to partner with you all in Newark is you're doing a lot. Hotels for people who are unhoused, whether they have COVID or whether they're COVID negative, trying to work with Rutgers to ramp up testing on your own. There's a lot going on in Newark.